So let's switch to exercise and diet, and let's pull those both together. How important are they in preventing heart disease and heart attacks?
We'll start with exercise first. So exercise, very important, and that's, again, for all-cause mortality, any chance of dying, and for strokes and heart attacks. There seems to be a J-shaped curve, meaning that you can do too much exercise and harm you and not enough. Where that falls out, usually 2 to 4 times a week at 30 to 60 minutes is kind of the sweet spot on how much to exercise.
What kind of exercise? Do we have to run? Can we walk? Can we swim? Can we do all the above? The more pain, the more gain? Do you have any thoughts on that?
Yeah, there's not an easy answer for that. Most people say, ask me, what does my heart rate need to get to? And there's no evidence for that. It's your orthopedic related issues. So running will cause more joint problems over time. The other question is, how much time do you have to exercise?
Sure.
So if you've only got a half hour, more vigorous exercise. If you can spread it out over 60 to 90 minutes, aerobic exercise tends to be more beneficial than anaerobic.
And exercise decreases the chances of getting heart attacks and heart disease later on.
It does.
Before we have to close out, let's talk about different kind of diets, and specifically I want you to talk about Mediterranean or DASH, or what kind of diet do you recommend patients eat?
Yeah, the first diet that came out in terms of let's look at heart attack prevention, historically we're always comparing this to just the low-fat, low-cholesterol diet we thought 20 years ago was a good idea. The DASH diet, which stands for Dietary Approaches to Stop Hypertension, this was an initial diet just to help improve blood pressure, but we found it does reduce cardiovascular events. Short version, it's very similar to the Mediterranean diet, which is the newest fad diet out there. It has the most recent evidence. Both those diets are higher in protein, lower in carbohydrates. What I tend to tell my patients is anything that's white on your plate, try not to eat it. So that's simple carbs, potatoes, pasta, rice. Try to eat the green vegetables and try to eat lean proteins, non-processed proteins.
Are people pretty good at following that advice?
It depends on how motivated they want to be. Again, my heart attack patients, yeah, because they've been scared. If it's a meet and greet in the office, sometimes it takes 1 or 2 times to discuss with them about the importance of diet.